Hi, this is a presentation for the WHO Urban Health Community. My name is Andrea Salmi and I'm an environmental engineer and researcher based in Lausanne, Switzerland. I spent 5 years doing a PhD research on the spatial analysis of healthy built environment at the PFL. During this period, I was also part of the ICUH community. I attended to many conferences starting from Kampala. And I built a network within the community of urban health, including academics and practitioners such as Carlos Dora, Tiago Yarigdasa, Marcus Grant, Natalie Robel, and many others whose work has generally shaped how I think about multi-sectoral urban health action. After my PhD, my career shifted towards sustainability and institutional consulting. Both urban health has remained central to my practice. I want to do this training because it gives me a structural tool, the WHO resource kit, that I could apply immediately, but I also could suggest to some of my clients in my current work. So, for the first scenario question that I would like to answer, I will give you a couple of examples. The first one was my role as evaluator for ATAP Plus, a Swiss federal program financing climate adaptation project across Switzerland. I was responsible of evaluating the project for the French and Italian speaking cantons, and we were evaluating a project for a yearly budget of 50 million francs. And these projects were directly related to urban health issues such as green infrastructure, heat protection, and protection from climate change crisis. Then a second example would be to a smaller scale with the support to municipalities locally in the Canton of Vaud in Switzerland, developing a long-term sustainability and climate strategy. My role was to provide the analysis and the evidence needed to identify the most appropriate solutions for their specific territory. The plan and merit integrated green areas, biodiversity, active mobility, air noise pollution management, heat island, invasive species posing epidemic risks, and water supply resilience, and a specific consideration for sensitive populations such as age-friendly design and children, with the different actors and stakeholders involved beside the institutions. And what I found most valuable in the process was exactly what the WHO resource kit addresses. The need to build a shared understanding across sectors before you can build a shared strategy and make it real. Then I think that I have an example for the scenario question number 3. The skills I see most critical for conducting a urban health capacity assessment are the ability to integrate evidence across disciplines without losing rigor, capacity to facilitate process where actors have different languages and priorities, and the ability to translate to complex evidence into something actionable for decision makers who are not researchers. I developed this through my doctoral research, which was inherently cross-sectional. My framework integrated transport, housing, green space, air quality, noise, health data from the Canton of Geneva. It integrated a lot of precise data and urban health experts, both locally and internationally, whose perspective I used to weigh parameters for the assessment. Beyond the PhD, I have developed these skills further through consulting work spanning federal offices, municipalities, private sectors, such as in tourism or building management and real estate, also corporate clients related to data centers and real estate or banks, or European Union institution. In each of these contexts, the challenge was the same, making urban health evidence legible and actionable for people operating in very different institutional registers. With this, I think that I would like to thank you in advance, and I look forward to joining this cohort and contributing to the peer learning process across sectors.